Welcome to the New Patient Chemotherapy Class for patients and families. This class is for all patients who will be starting chemotherapy. We will cover important information to prepare you and your family for receiving chemotherapy. In this class, you will learn about what to expect during chemotherapy, how to manage possible side effects, and how to look after yourself during chemotherapy. This class covers general information. Specific information about your treatment protocol will be given by your cancer care team and by the chemotherapy nurse and pharmacist when you have your first treatment. Keep a notepad on hand during the presentation to write down questions for your cancer care team to answer later. This video will review who your cancer care team is and who to call, talk about what chemotherapy is and how it is used to treat cancer, explain the common side effects of chemotherapy and how to manage them, share some resources to help you and your family cope during chemotherapy treatment. Lastly, we will talk about what to expect on your typical visit to the Cancer Center. There are many people involved in your care at the Cancer Center. The team works together to give you and your family the best care and support during your cancer journey. You and your family are the most important members of the care team. You know best about your health, your values, and your needs. The rest of the team will work with you to provide care that focuses on your needs and goals. The healthcare professionals involved in your care will depend on your individual situation. Beyond our doors, you still need to keep close contact with your family doctor. They continue to provide care and order your routine medications as well as manage any pain medications you may need. Community nurses also provide care if needed while you are at home. At any time, if your problem is a medical emergency or if you don't know what to do, go directly to your nearest emergency department or call 911. Our oncology clinic can offer support Monday to Friday from 8:30 to 4. You can call the helpline for symptom management. After Hours Care Service, called CarePath, provides telephone service from 4 p.m. until 8:30 a.m. when our clinic is closed. CarePath is supported by oncology certified nurses that you can call with questions related to symptoms or side effects. They will notify us with a fax if you have contacted them, and we will follow up with you as needed. Also available is your home care nurse. Depending on the type of cancer and goals of treatment, there are a number of different kinds of treatments you and your oncology team may use to treat your cancer, including surgery, radiation, chemotherapy, or a stem cell transplant. This class focuses on chemotherapy and how it works. Chemotherapy is a drug that destroys cancer cells or slows them from growing or multiplying. It can target cancer cells in areas of your body that sometimes radiation or surgery cannot reach. Chemotherapy can be used alone or together with other forms of treatment. The type of cancer you have determines the chemotherapy drugs you receive. There are hundreds of different chemotherapy drugs. You may receive one chemotherapy drug or a combination of different chemotherapy drugs. The specific treatment plan is often called a protocol or regimen. Chemotherapy drugs can be given in different ways. How they are given depends on the type of drug and your type of cancer. Chemotherapy can be given by mouth, as a pill, capsule, or liquid, by infusion directly into your vein, using an intravenous or IV, or by injection under your skin using a needle. If you receive your chemotherapy through an IV or through the skin, it will be given in the chemotherapy clinic. We are going to focus quite a bit on the possible physical side effects of treatment, but we feel it's important to talk a little bit about taking care of your emotional health at the beginning of this session. We know that this can be an overwhelming time for you, especially if you are dealing with a new diagnosis or starting a new form of treatment. Feelings of anxiety and sadness are normal for patients and families coping with cancer. We encourage you to share how you are feeling with loved ones and with your cancer care team. It helps to talk, and it also helps others in your life understand how they can help you. If your feelings continue and start to interfere with your ability to do regular activities, you should seek extra support. Let your doctor and nurse know how you are doing. On the screen, we have listed some things that you can do to help your emotional well-being. Find support. can make you feel better and less alone. There are social workers available who can provide you with additional support and navigation for coping with emotions and practical or financial issues. Focus on things that make you feel better. Think about the positive parts of your life and things you can control. Take care of your body. Eat well, exercise, and improve your sleep. Make lists of calming, enjoyable, and useful activities. When you feel anxious or down, get your list and choose an activity. Try relaxation activities like breathing exercises, meditation, guided imagery. Get counseling to help you cope. Learn different ways of thinking and acting to help you cope. Chemotherapy is effective at destroying rapidly dividing cells. However, chemotherapy can't tell the difference between a healthy cell and a cancer cell. This explains why we have some damage to our normal cells, which causes side effects. The normal cells that are most commonly affected by chemotherapy are blood cells, cells in the gut, cells in the mouth, skin, and nail cells, and our hair follicles. This damage to the normal cells is the reason for many of the side effects people experience. The most common side effects of chemotherapy are low blood counts, your white cells, platelets, and red cells, nausea and vomiting, bowel changes such as diarrhea and constipation, fatigue, and hair loss. Each of these side effects will be explained in more detail. It is important to remember that everyone reacts differently to chemotherapy. Many people worry that they will have the same experience as someone else they know who has had chemotherapy. Even people who are taking the same kind of chemotherapy may react differently. It is important to not compare yourself to others. Side effects depend on the type of chemotherapy you receive, the dose you are given, and how your body reacts to the chemotherapy. You may experience none or some of these side effects. Your cancer care team will go over the specific chemotherapy you will get and the side effects you can expect to have. They will continue to assess you for these side effects while you are being treated. It is important to tell your cancer care team what side effects you experience so they can help you manage them. The biggest part of managing side effects is understanding them, so for each side effect we are going to go over 3 important parts. 1. What to expect. 2. What you can do to manage the side effects. And 3. When to get medical help. Information on managing side effects can be found on the drug handouts you will be given and in the Canadian Cancer Society booklet, Chemotherapy and Other Drug Therapies. Cancer Care Ontario has many useful resources for patients as well as medical professionals. You will find information on treatments, medications, and how to manage your symptoms. You can access Cancer Care Ontario at www.cancercareontario.ca. One of the main side effects of all chemotherapy is that it lowers the amount of blood cells floating around in your bloodstream. There are many kinds of blood cells in your body. The blood cells that may cause concerning side effects are white blood cells, platelets, and red blood cells. White blood cells are part of your body's immune system. They defend your body against viruses and destroy bacteria. Platelets are cells that help your blood to clot. Normally when you cut yourself, platelets make a clot so that the bleeding stops quickly. Red blood cells carry oxygen to all parts of your body. To monitor your blood counts, you will need to have regular blood tests. This is the only true way to know if your blood counts are low. Your cancer care team will check the results of your blood tests before each chemotherapy treatment you receive. If your blood counts are too low, your treatment may be delayed by about a week to make sure your counts do not drop to a dangerous level. Next, we will talk about each type of blood cell and how they can be affected by chemotherapy. Your white blood cells help protect you against germs and infections. What that means is you will have less defense against germs and are at risk for infection. When your white blood cell count is low, it is also called neutropenia. A drop in white blood cells usually occurs about 7 to 14 days after your chemotherapy was given and lasts for a few days. What you need to remember about low white blood cells is that it means you have less defense against germs and are at risk for infection. Because you will not be able to feel when your white blood cell count is low, it is important to make sure you know what you can do to avoid infections like wash your hands often, especially after eating and going to the bathroom. Carry a small bottle of hand sanitizer for when you can't get to a sink. Avoid anyone who is sick. Stay away from anyone who has a cold, the flu, or an infectious disease, anything that can be passed from person to person. Check your temperature. You will need to get a thermometer. Refer to your yellow fever card in your folder. Know the signs of an infection. One sign of infection is fever. We will go over this on the next slide. For this reason, it is important to check your temperature with a digital oral thermometer daily, and check your temperature if you feel hot or unwell, for example, if you have chills. Avoid taking medication that treat a fever, for example, Tylenol, before you take your temperature, as they may hide a fever. This is the fever card. If you have had chemotherapy in the last 30 days by IV, pill, or needle, and you develop a fever, go to your nearest emergency department. This may be a medical emergency. We discussed that fever can be a sign of an infection. Make sure you have purchased a digital oral thermometer before your treatment begins. While you are on treatment, it is important that you monitor yourself for a fever. Check your temperature with a digital oral thermometer daily, and check your temperature if you are feeling hot or unwell. Avoid taking medications that treat a fever, for example, Tylenol, before you take your temperature, as it may hide a fever. Please refer to the yellow fever card in your folder for instruction about a fever. If you have a fever, check every 15 minutes. If the temperature remains at 38 degrees Celsius for over an hour, or if it is 38.3 degrees Celsius one time, please go to your nearest emergency department right away with your fever card and a list of your medications. You must go to the emergency even if you feel well. Do not take anything like Tylenol or Advil to treat your fever. Some signs of an infection are loose bowel movements, chills or sweating, burning or frequent urination, severe cough, sore throat, or mouth sores, an open area or wound that appears red or swollen. If you experience any of these symptoms, even if you feel quite well, it is important that you go to the emergency room right away. Do not wait and see. You need to go to the emergency room. You will not know if you have a low white count, and you need to get some blood work done at the hospital. It is important to start treatment right away for a possible infection because it can get worse very quickly. You will likely be treated with antibiotics. Chemotherapy drugs can cause your body to make fewer platelets. Without enough platelets, you may get bruises, even when you haven't bumped into anything. You may bleed easily from your nose or mouth or get a rash of tiny pinpoint red dots, called petechiae. If you have a low platelet count, preventing bleeding from an injury is important. Things you can do are use a soft toothbrush. If you floss, do so gently so that you do not bleed. Use an electric razor so that you are less likely to cut yourself. Avoid activities that may result in injury. Avoid getting constipated because straining for a bowel movement can cause bleeding. Do not take aspirin or ibuprofen, herbal supplements, or any new medications without speaking to your cancer care team first. The medications can increase your risk for bleeding. Call your doctor or nurse if you have any unusual bleeding. If you cannot get in touch with your cancer care team, go to your nearest emergency department right away. Examples of unusual bleeding include unusual or heavy nosebleeds, red or pink colored urine, black tar-like stool or bowel movements, or blood in the stools, red or brown colored sputum or vomit, dizziness, constant headache, or blurred vision. This may happen with bleeding in the head, bleeding of your gums, especially when brushing your teeth, heavy vaginal bleeding. Red blood cells carry oxygen around in your body. When your red blood cell count is low, you may feel more tired. For example, you may become out of breath when climbing the stairs. If you feel tired, make sure you save your energy, pace yourself, take naps during the day if you need to, and try to take a short walk or exercise a little every day. Exercise has been proven to assist with fatigue. Eat a well-balanced diet and drink enough fluids. Call your doctor right away if you feel dizzy, short of breath, or have headaches or ringing in your ears. If you cannot reach anyone, go to your nearest emergency department. These may be symptoms of anemia, which means your red blood cells are too low and the tissue in your body are not getting enough oxygen to do their job properly. Your doctor may suggest a blood transfusion. When your blood counts are low, even simple things can be risky. Here are some things to avoid while on chemotherapy, either oral or intravenous treatments. No invasive procedures unless your oncologist has approved. These include cataracts, scopes, surgeries. Generally, no poking or breaking the skin of any kind unless you've spoken to your doctor. No dental work, none, not even cleaning. Your oncologist must approve this even if it's urgent dental work. Let your dentist know you are on treatment for cancer. No manicures or pedicures. There is a risk equipment could carry bacteria. Most consideration should be given to the environment around you. Think about where germs come from and how they are passed along. What to be mindful of. Eating out. Be careful with your food choices, where you go and what you eat. Avoid things like buffets and bulk food items as well. Make sure you safely store your leftovers. No unpasteurized foods. Swimming. Remember, bacteria grows in warm temperatures. Avoid lakes, public pools, and hot tubs. Gardening. If you are gardening, wear a good pair of gloves. Pet care. No scooping poop of any kind, not in the yard or in the litter box. Always, always, always clean your hands. Nausea and vomiting can happen before, during, or after your chemotherapy treatment. For most people, it usually happens on the days you receive chemotherapy and for a day or two later. For some people, thinking about treatment can bring on nausea. Let your cancer care team know if this is happening. Nausea and vomiting is one of the most feared side effects of chemotherapy. But not all chemotherapy causes nausea, and nausea can be controlled very well with anti-nausea medications prescribed by your doctor. Different anti-nausea medications work differently, so you may be prescribed more than one drug to manage nausea. Your anti-nausea medications are usually ordered to take before and after your chemotherapy to prevent or reduce nausea and vomiting. Some of your anti-nausea medications are taken on a schedule prescribed by your doctor, and others are taken only when needed. It is best to take the as-needed anti-nausea medications as soon as you feel any nausea. Do not wait for the nausea to get worse. It will be harder to keep pills down if you are already vomiting. Your care team will go over your anti-nausea medication schedule in detail with you on your first day of treatment. If you notice a pattern of when you get nausea, take your anti-nausea medication at least 30 minutes before that time to prevent it. In addition to taking your anti-nausea medications, you can also try these tips. Eat smaller meals and snacks more often during the day. Sip water, juices, and other fluids during the day. Let other people do the cooking. Avoid spicy foods or foods with strong smells. Do activities that are relaxing. Keep track of when you feel nauseous or vomit and tell your nurse at the next visit. Call your doctor or nurse if you have vomited several times and can't keep food or fluids down for more than 24 hours, even if you're taking your anti-nausea medication as directed. If you cannot get in touch with a health care provider, go to your nearest emergency department right away. Some chemotherapy can cause sores in your mouth or throat called mucositis. Symptoms of mouth sores are soreness, redness, and white patches in your mouth or on your tongue. You are at the highest risk of getting mouth sores around 7 to 14 days after your chemotherapy treatment. You can lower your chance of getting mouth sores by following these tips for good mouth care. Use a soft toothbrush and waxed dental floss. Remove dentures if your gums are tender. Avoid mouthwashes with alcohol as they can dry out your mouth. Use a baking soda mouth rinse several times a day. Avoid alcohol and spicy or acidic foods and liquids. If your mouth is sore, you may find eating soft, bland foods like cooked cereals, mashed potatoes, and puddings easier. If you develop an open sore in your mouth, tell your doctor or nurse. You may need some medicated mouthwash to help treat the open sores. Open sores in your mouth have the potential to lead to an infection. Check your temperature if you start to feel unwell. Taste changes. Sometimes described as a metallic or chemical taste or a lack of taste. Taste changes can happen any time during your treatment, and they usually stop about 3 to 4 weeks after the end of treatment. Cancer Care Ontario has resources called Coping with Taste Changes or How to Manage Your Mouth Problems. You can find these on the Cancer Care Ontario website. Try sugar-free mint gum or hard candies. Flavors like mint, lemon, or orange can mask a bitter or metallic taste. Use plastic utensils and glass cookware rather than silverware or cast iron. Experiment with foods using spices and seasonings. If you have tried managing taste changes and there is no improvement, we can refer you to a dietitian for more information. Diarrhea can be another common side effect of chemotherapy. Diarrhea happens when you have soft, loose, or watery stools more than 3 times a day. It can be caused by chemotherapy, by infections, or by other drugs you take. Certain chemotherapy drugs can cause more diarrhea than others. Your cancer care team will tell you how to manage this with medications. It is important to tell your nurse if you have diarrhea, as it can cause other problems such as losing too many fluids from your body, weight loss, and even fatigue. If you have diarrhea, rest and drink lots of fluids like water, juice, and sports drinks. Try to avoid caffeine and carbonated drinks as they can make your body lose more fluids. Avoid natural laxatives such as prunes, rhubarb, and papaya. Eat small meals more often. If you have 6 to 8 or more loose bowel movements daily for more than 2 days, call your doctor or go to the nearest emergency department. Constipation happens when you are not having bowel movements as often as you used to. When you are constipated, your stool is hard and dry, and having a bowel movement can be difficult or painful. Like nausea, it is important to prevent or reduce constipation before it gets worse. Your doctor may suggest stool softeners and laxatives that you can buy without a prescription, but be sure to talk to your doctor before taking anything. If you find you are constipated, try adding more fiber in your diet from foods such as whole grain breads, fruits and vegetables, dried fruit, and prunes. Drink plenty of liquid during the day and be more active if you can. Some patients find that constipation is a more frequent problem than diarrhea because anti-nausea medications usually cause constipation. Constipation can be prevented and managed with medications. Eating well can be difficult depending on the type of cancer you have and the treatments that you receive. Eating well is important because it will help you to maintain your body weight, improve your strength and energy, decrease the risk of infection, and assist your body with healing and recovery from your cancer treatments. Registered dietitians are available to help you meet your nutritional needs before, during, and after chemotherapy. A registered dietitian will provide a nutritional assessment and help you set realistic goals, help you to manage symptoms or side effects related to cancer and treatments, such as unintentional weight loss, loss of appetite, trouble swallowing, taste changes, sore or dry mouth, nausea, vomiting, diarrhea, or constipation. You can ask a member of your cancer care team to refer you to a registered dietitian. Hair thinning or loss, called alopecia, can be caused by some, but not all chemotherapy. Hair loss can occur gradually or quite quickly. It often begins 2 to 3 weeks after chemotherapy starts. Hair loss can occur on all parts of the body. Head, the scalp may also feel tender. Face, some or all of the eyelashes and eyebrows may fall out. Body, some or all of the pubic, chest, and underarm hair may fall out. Not all chemotherapy causes hair loss. Find out from your nurse or doctor if your chemotherapy may cause your hair to change so that you can know what to expect. If you are receiving a type of chemotherapy that causes hair loss, it usually occurs 2 to 3 weeks after treatment begins. Hair loss is usually temporary and may start growing back during treatment, or 3 to 6 months after treatment finishes. Hair loss can be one of the hardest symptoms to cope with, both physically and emotionally. Some patients have found these tips helpful. Preparing family and friends. Get a short haircut before treatment starts. Find out about options for paying for a wig. Some insurance and medical plans cover the cost. It can also be deducted as a medical expense on your income tax. Choose a wig before your hair falls out. Be gentle with your hair. Use mild shampoo and avoid hair dryers, dye, perms, or straighteners. Protect your scalp from the sun. Try to use a satin pillowcase. Satin creates less friction than cotton and may be more comfortable for you when you sleep. There are some options available to you for hair care and accessories during cancer treatment. Look Good, Feel Better program offers women tips to manage appearance-related side effects of cancer, including how to care for your skin and nails. You can register for an online workshop on the Look Good, Feel Better website. We have a fact sheet here with a list of local businesses that sell wigs and hair accessories. Ask your nurse. Chemotherapy can make your skin drier and more sensitive to the sun. Your nails may become brittle and cracked. These changes usually go away once treatment is over. Try the following to reduce the chances of having dry skin and cracked nails. Bathe in warm water instead of hot water so that your skin does not dry out. Wash and moisturize your skin using alcohol-free and exfoliant-free soaps, creams, and lotions made for sensitive skin. Avoid direct sunlight and use sunscreen with an SPF of 30 or greater. Use cuticle cream instead of cutting the cuticles of your nails. Do not squeeze or scratch pimples. If you notice changes to your skin and nails, be sure to tell your nurse or doctor at the next visit. The Look Good, Feel Better program offers women tips to manage appearance-related side effects of cancer, including how to care for your skin and nails. You can register for an online workshop at their website, www.lgfb.ca. Fatigue can be described as feeling tired or having a total lack of energy that does not go away with sleep or rest. Cancer-related fatigue is more severe and lasts longer than other types of fatigue that you may have felt in everyday life. Most people with cancer will experience cancer-related fatigue at some point along their journey. For many, it can be very distressing. The best advice to follow is if you feel fatigued or tired, listen to your body. Stop what you are doing and rest. This could mean stopping in the middle of vacuuming and finishing later, or asking someone else to do it. Some ways to reduce or manage fatigue and help yourself feel better. Plan the most important things first in the morning if that is when you have the most energy. Rest during the day, but leave long sleep for the nighttime. Try not to nap longer than 1 hour. Go to bed and get up the same time every day. Try light exercise like walking. Studies have shown that exercise helps to combat fatigue. Eat a well-balanced diet. Try smaller, frequent meals, and drink lots of fluids. Accept help from family and friends. When they offer, let them help. Fatigue may continue after your treatment finishes. Keep your nurse and doctor up to date on how fatigue is affecting you. Resources may also be found on the Cancer Care Ontario website. A small number of people will notice problems with memory and concentration. Sometimes this is called chemobrain or mental fatigue. This can include having trouble with short-term memory, such as forgetting where you put things, what you were talking about on the phone, or phone numbers, being easily distracted, tire easily when doing things that need mental energy. It is unknown exactly how chemotherapy affects the brain, so it is not clear if chemotherapy directly causes these problems alone. Changes in memory and concentration can be very subtle and mild and can be related to the amount of fatigue you feel. Mild cognitive problems tend to respond well to rehabilitation efforts, such as cognitive retraining techniques and exercises. Exercise your brain with crosswords or puzzles, painting, playing an instrument, or learning a new hobby. This is a quick summary of when you can expect certain side effects to occur. Just a reminder that not everyone will experience all side effects shown here. Your doctor or nurse will give you more information about the specific side effects you can expect to have. Some types of chemotherapy can cause sexual changes. These changes are different for women and men. There is a lot going on emotionally and physically during treatment that can affect your desire for sexual activity, your physical sexual functioning, and or changes in your sexual response. Here are a few things to remember during cancer treatment. You can talk to members of your cancer care team about sexual changes or side effects. It may be an uncomfortable subject to bring up, but sexuality is a big part of quality of life for many people, and we can help you. Be open and honest with your spouse or partner. Talk about your feelings and concerns. If you are having sex less often, try other activities that make you feel close to each other. Use a condom for 7 days after you receive chemotherapy because a small amount of chemotherapy may be present in semen or vaginal fluids. If you or your partner are able to become pregnant, you must use birth control. It is very important that you not get pregnant while having chemotherapy. Chemotherapy can hurt the fetus, especially in the first 3 months of pregnancy. Talk with your nurse or doctor about birth control and ways to keep from getting pregnant during treatment. For more information, see the handout on sexual activity and systemic therapy at the back of your education folder. Some chemotherapy can cause fertility changes in both men and women. Infertility is the inability for women to become pregnant or for men to get a woman pregnant. Whether or not your treatment will affect your ability to have a child depends on which drugs you are taking, your age, and your general health. Not all chemotherapy drugs lead to permanent infertility. If you plan to have children in the future or think you might want to, tell your cancer care team as soon as possible. Talk to your doctor before starting treatment so that you have as many fertility options as possible. It is important that you safely handle any bodily fluids for 7 days after each IV chemotherapy treatment. If you are taking oral chemotherapy, you will need to be safe continuously. Your body fluids include urine, vomit, stool, blood, semen, and vaginal fluid. This is because small amounts of chemotherapy are in these bodily fluids. Chemotherapy works to treat your cancer, but it can be harmful to others if they come in contact with even a small amount. This is why you will see nurses in the chemotherapy treatment area who administer your treatment wearing protective gowns and gloves. Safe handling precautions you should take after each chemotherapy treatment include: flush the toilet twice after use with the lid down, sit on the toilet when urinating, wear gloves if cleaning up or handling soiled items, double bag soiled disposable items, wash any soiled linen twice in your washing machine, hot water and separate from other laundry, wear a condom during sexual activity. Please refer to the Safe Handling of Body Fluids handout inside your folder. It is important to remember that hugging and kissing is safe. You can still be around small children. Please note that some treatments do not require safe handling precautions. Ask your nurse. In this section, we will cover what you can expect on the days you receive chemotherapy treatments, including the types of appointments you will have, and what to bring with you to your appointments. During your chemotherapy treatment, you will generally have two kinds of appointments. One where you will see your nurse and doctor, and the other where you will receive your treatment. How often you have these visits depends on your specific chemotherapy protocol. We will go through what you can expect on these days. Step 1. Register at the registration desk. A typical clinic visit will start with getting your blood work done. Your blood work allows the cancer care team to check your blood counts and make sure your body is healthy enough to receive treatment. You may book your blood work in the oncology lab by calling the number above, online, or by using the QR code provided in your package. You will then have a checkup with your doctor and nurse in the clinic. They will assess you to ensure you are well enough to start or continue chemotherapy treatment. Remember, this is your time to tell your doctor or nurse how you have been doing and explain any side effects you have had. Some people find it useful to write notes or questions down on a notepad and bring it with them to their doctor appointment, so they cover all their questions and concerns. Bring up any questions about prescriptions at this visit. You will be told at your clinic visit if your chemotherapy treatment needs to be delayed for any reason, like if your blood counts are too low. The Your Symptoms Matter questionnaire will be given to you when you register at the reception desk. Please complete this form while you wait for your appointment. The nurse will use it when she assesses you. When you fill out the questionnaire, the scale relates to how you are feeling that day. Please do not forget to tell us about any difficulties or side effects or symptom changes you've had since your last visit. Once your chemotherapy has been prepared by the pharmacy, a nurse will start giving you your drugs through the IV. Before that, the nurse will give you any pre-medication you may need to control nausea or reduce the chance of a reaction to the chemotherapy. The nurse reviews all of your blood work and checks your chemotherapy dosing again before she gives it to you. She will ask you your name and birthday and compare it to her paperwork and your wristband. A second nurse does the exact same. The nurse will check on you regularly and take your vital signs: blood pressure, heart rate, temperature, and oxygen levels. Most patients do not feel pain or anything unusual while they get their cancer drugs. If you do feel something unusual, tell your nurse right away, even if you don't think it's important. After your first treatment, you will probably get a prescription for medication to help with side effects like nausea. We can fax this prescription to your community pharmacy so that you can pick it up on your way home. Make sure you have a copy of your next appointment before you leave. The nurse will give it to you. Make sure you have had your blood work done. Your doctor or clinic nurse will give you a lab form that you can take to Life Labs or a Quinty Health outpatient lab. For first treatments, your blood work may have been done at your last appointment. Have someone available to drive you home after your treatment, especially for the first visit. You may see a cancer center pharmacist on this day. Eat a light meal prior to your treatment, or bring a snack with you. COVID and cancer, what you need to know. People with cancer may have a higher risk of getting COVID-19 and may get very sick from COVID-19. If you are not vaccinated, please let your cancer team know before you start treatment. There are many supports and resources for cancer patients. If you are looking for information about cancer, cancer treatment, and living with cancer, please take a look at the patient handout wall in the waiting room. This concludes our presentation. We hope we've provided answers to the many questions you might have.